Phil Quinlan from the University of Nottingham, who's going to tell us his perspective on technology services ecosystem, but really talk about the Alliance and his work in general. Thanks, Phil.
Thanks very much, and it's good to see so many of you here. I think it's one of the first meetings where so many people have been back together, so it's good to see you. What I want to do is talk through some of the work we've been doing with the UK CRC Tissue Directory and Coordination Centre, which is around biobank in the UK, with what we've been doing at the University of Nottingham. So first up, I just want to give you a little introduction to who and what my group is. So we are a digital research infrastructure, so a team of techies, I guess, is the best way to describe us, or research software engineers. And we get involved in multiple research projects. We also get the opportunity to lead research projects as well. And one of those is to lead the UK CRC Tissue Directory. We've also been leading with Emily and Aziz and Susan Hopkins, the CoConnect project. And we are just approaching 10 years old, so we're hosting an event in Nottingham on the 21st and 22nd of July. So to give you an idea of the work that we're doing in the biobanking space, it was set up in 2014. Our budget was around about 300,000 a year, so relatively small, but still enough to be doing some really cool things. And really, this was a very strong focus on what we're trying to do with data. So samples are obviously just the very raw materials, so the raw aspects that you generate data from. So we approach this very much from a data perspective. And just recently, we've just registered just over 300 biobanks into our directory, which you can access online. So this was kind of the background of where we started, and we were very keen, because we've been doing this work before, we know how hard it is to bring a community together. So one of the founding members of the Alliance to come in early and want to show how we can bring the biobanking community to the data community. And one of the reasons that we were very keen on this was some work that was done by Emma Lawrence, who was based at UCL at the time, and we were trying to understand what is the actual value of biobanks, why do people want to find biobanks, what motivates them, but what's also the challenges. So when we're asking, what are the barriers? If you want to access another biobank for samples, what are your current barriers that would prevent you? And the two things that came out right at the top were lack of clinical data and also the quality of the sample. So these are the biggest barriers that researchers felt were present to be able to access other biobanks. If we ask them, what would motivate you to go to a new source for samples? The things that came through, a range of samples, sample quality data available, and you can see the things that would motivate them are also the things that they're saying would prevent them. And that's a problem. How do we change that dynamic to make sure data is linked to the samples? And one of the things that we really want to understand, the biobanks are very data rich. How do we support them? Because one of the challenges when you have a directory, you minimize the data down to a core kind of metadata standard, which represents everybody the same. But not everybody is the same. In terms of the data they can provide in biobanks. So how do we kind of showcase the data? So I'm going to talk you through where we went with this. And really what we realized is to showcase the data, we had to move from metadata to row-level data, let people actually search on the actual data that the biobanks have. We knew that had to be federated, but the only problem was we had no experience in doing federated systems. We'd never done it before, as a group or anybody else in the university. So we knew we couldn't just go and build that ourselves, but what we did know was we had a real clear understanding, both what the community needed from the biobank's perspective, but also what the researchers needed. That's what we brought to the table when we talk about co-creation. We couldn't bring a ready-made solution, but we could bring the insight and the knowledge. So co-creation, I'm going to just talk you through this, how we progressed, but co-creation, I think, is something very easy to write on a grant application, but much, much harder to do in reality. And this is what we experienced. It's really quite hard to get co-creation working at scale. So it all started back in 2017. We had £30,000 of seed funding from the university to try working with a company called BC Platforms to see how we could utilize their software in a different way. What we didn't want to do, though, was just buy software and then be locked into that as a proprietary standard. So we started a joint research project with them. How can we turn a proprietary system that's completely behind closed doors into a system that is driven by open standards and open APIs? We also got some funding from the EPSRC in terms of Impact Accelerator to second some of our staff into the company to gain that knowledge and understanding of how it all works so we could co-create a solution together. In 2019, we started to understand how could we rapidly deploy these tools into cohorts. So it's great that we'll be able to work with people like Ausback, with the NHR Bioresource, Genomics England, but also the NHR the BRC, the Biomedical Research Centre in Nottingham, where we had also access to clinical data sets to try this on to see how it would actually work. And then it kind of went very quickly after then. We started developing an open source connector based on those open standards, building into the CoConnect program, which is a £4 million piece of research, supporting the national core studies in terms of what the cohort discovery is, and also now starting to underpin some of this, the foundational work for QQR2 in terms of the ecosystem. So you can see from a very basic idea, from no understanding how far we've gone in just 5 years. So we've gone from absolutely no capability to helping to build some of the national infrastructure on this. We really believe in that co-creation model. We could not have done that alone. We had some insight, we didn't have the software. We had some ideas of standards, but then HDR were to come in and help us with the standards, people like Shashil. We knew how to build a system, we didn't necessarily know how to make it productionized. In comes Jerry. So as a team, we worked together to understand how we could build this and make this something that's sustainable. And we've worked with industry to help move them away from proprietary standards to open standards and open APIs. So now thinking about the future of the ecosystem, I think it's really important we try and move away from open source licenses, because that's something that's really proactively encouraged. Let's release the software with an open source license. It's kind of pointless unless we have an open source community. That's what Elixir and EBI do really well. It's not just licensing they worry about, but how do they build a community around that software? And so the last thing I want to say about how we think about the future, people talk about team science, and it's not about a team. So the best definition of team science is a team of teams doing science. And I think that's what we need to get to with open standards, open APIs, and working collaboratively across the ecosystem. And that's it from me. Thank you.